I first heard about borderline personality disorder 20 years ago in psychopathology class. I was 24. I had never heard of borderline personality disorder before. I had never even heard of personality disorders before. I remember the instructor telling us that personality disorders were the only disorders in the DSM that required 6 months of client data before you could diagnose someone with it. I thought to myself, 6 months? That's a long time. Why does it take so long? Contrary to this, he also told us that we could diagnose depression and anxiety within a short 5-minute interview with a client. And borderline personality disorder takes 6 months. That's weird, huh? And the symptom list was weird to me too. I'd never heard of personality disorders. They seemed so strange to me. I'd heard of depressed people before, and I had experienced anxiety myself by then, but personality disorders sounded completely foreign to me, and I was sort of scared of them, to be honest. Then a year later at my internship, I had a very difficult client. She would alternate between making me feel like the best therapist in the world and making me feel like a worthless person. And I remembered that this was a red flag for borderline, in that borderline clients often make therapists feel this way. So I began assessing for borderline with this client. And sure enough, after several months and after consulting with experts on borderline, it seemed I had my first borderline client. And then people told me to refer her to someone else because these clients are no fun to work with. But I found that I actually enjoyed the struggle with this client. It felt like real therapy to me. It involved all the things I enjoyed about being a therapist. Things like transference and countertransference and projective identification and corrective experiences and the therapeutic relationship and so on. But it was hard work. She was exhausting and frustrating at times. And after our sessions, I often felt mildly traumatized by her. But ultimately, it was highly rewarding to work with her. The struggle was worth it because after months and years, her symptoms decreased. She found that she began to like herself. She found that she was able to trust others for the first time in her life. And my work with her was very meaningful to me in this way. But then I heard people talking at my agency, and they had also had borderline clients, and they hated working with them. I heard them saying very hateful things, very judgmental things about them. They said it was a waste of time to work with borderlines because therapy just reinforces their dependent and dramatic nature. These therapists looked for ways to get rid of these clients. So I told them to send them to me because I liked working with them. And since that time, I've worked with many borderline clients in my 20 years of being a therapist, some successfully and some not so successfully. I've read everything I can get my hands on regarding borderline. I've lectured on the treatment of borderline personality disorder, and all of my supervisees eventually need help with a borderline client, if not several borderline clients. I've even had borderline students before, actually. That might surprise you that sometimes people diagnosed with borderline who fit the criteria, they decide to become therapists, and so that happens at times too. And then I saw borderline personality disorder being portrayed in movies. In Fatal Attraction, Glenn Close's character was identified by some to be indicative of borderline, and as a result, people thought that borderline people would try to kill you if you broke up with them. In the movie Girl Interrupted, the Winona Ryder character was supposed to have borderline personality disorder, but to me, she just seemed a little depressed. And as a result of this popular movie, people got a very inaccurate representation of borderline, in my opinion. Some people even think that Darth Vader is borderline because of the way he behaved as a young man. For example, he loved Obi-Wan and then suddenly hated him. And he intensely loved Padme in a self-destructive manner, which is, also somewhat indicative of borderline. But I think it's a little silly to equate Darth Vader as borderline. He doesn't really fit it. And then there was the movie Silver Linings Playbook. The Jennifer Lawrence character is supposed to have borderline, I think. They never actually said it in the movie, but it seemed pretty clear to me that they were trying to portray her as having borderline. And I think they actually accurately represented what a mild case of borderline looks like. That is, until the end of the movie, when, spoiler alert, they have a happy ending to the movie. And if the movie was to accurately portray borderline, there would have been a more nuanced ending, I think. But I would say of all the popular depictions of borderline that I've seen, I would say Silver Linings Playbook is the closest to reality. But again, just know that they're depicting a very mild case of it. And then I started podcasting, and I would get emails about borderline. Like this one from listener Kristen, who is a psychology student, or at least was when she emailed this. She said, "Can you do a podcast on borderline personality disorder? I've studied case studies and theories, but still cannot clearly summarize the disorder. I understand supposed causes of borderline personality disorder and that DBT is specifically used as a form of treatment. The clearest way someone has been able to summarize borderline personality disorder to me is someone who cannot take responsibility for themselves. I know there is a lot more to this, and that some therapists see patients with borderline personality disorder as their worst nightmare because of suicide attempts and successes. Could you shed some light on this disorder?" That's the end of the email from listener Kristen. And then I recently did an episode on psychodynamic self-analysis in which I analyzed my countertransference during a difficult clinical moment with a borderline client. And then a patron of the podcast emailed me. She gave me permission to read the following. "I just listened to this episode and wanted to tell you just how much I liked it. I was very much able to relate to the incident you described, as I have borderline personality disorder and my therapist has suffered much abuse from me over the years. I have lost count of how often I've told him that he's incompetent, has no empathy, doesn't understand anything, doesn't care, is callous, and a terrible human being. Even though I usually end up feeling really bad and remorseful when these episodes are over and resolved, listening to your experience has given me more empathy for my long-suffering therapist. I was really surprised hearing you say that you like working with people who have borderline. I am sure an episode by you would do away with some of the stigma attached to this diagnosis. You have all of these impressionable students and novice therapists listening. I bet they could benefit from some less judgmental information about borderline personality disorder. Really, doing an episode on borderline would be good for the greater good of humanity and leave the world a better place. You should really, really consider it, and I would be eternally grateful." That's the end of the email from the patron. Well, since you're a patron, your wish is my command. So, in this episode, I will read more from this anonymous email, and I will review the literature on borderline, which goes all the way back to Freud. And I will describe how to understand people with borderline personality disorder, and how to treat them, and how to cope with them, and how to deal with people with borderline traits in your personal life. Welcome to the Psychology in Seattle podcast. I'm your host, Dr. Kirk Honda. I am chair of the Couple and Family Therapy program at Antioch University, Seattle, and I'm also a licensed psychotherapist. This episode is just for patrons of the podcast, so if you're listening to this and you're not a patron of the podcast, this episode will end before the content begins. If you want to hear the full episode, you have to become a patron of the podcast by going to patreon.com. That's patreon.com to become a patron of the podcast. Patrons of the podcast get access to exclusive episodes like this one, along with other various benefits and swag.